U.S. maternal mortality rates have more than doubled in the last 2 decades. And it's leaving everyone to ask why. The mainstream media and the abortion lobby seems to be pushing the idea that all we need is to impose more abortion and that will simply solve the problem. It's apparently safer than giving birth, is what we've heard time and time again, right? Abortion's safer than giving birth. My guest today will clear this up for you. We have Dr. Ingrid Skop with the Charlotte Lozier Institute and our very own Gavin Oxley, who serves as Students for Life's Medical and Law Coordinator. I'm Kristan Hawkins, and welcome to the Explicitly Pro-Life podcast. Now, today we're going to talk about the OBGYN shortage that you've been probably reading about that's is now supposed to be blamed on Roe versus Wade falling, and also maternal mortality. And we've got a lot to dig into, but first I want you to read the creds of our two guests today because they're simply incredible. Dr. Ingrid Skop, if you don't know her, you need to know her and follow her. She is a practicing board-certified obstetrician gynecologist in San Antonio, Texas. She has been one for more than 30 years. She's a fellow at the American College of OBGYN, a former board member of the American Association of Pro-Life OBGYNs. She currently practices with the OB Hospitalist Group and is also vice president of medical affairs of the Charlotte Lozier Institute. She currently serves as medical director for Any Woman Can Pregnancy Resource Center in San Antonio, and she previously served as board chairman. She serves as on the medical advisory board of Save the Storks. She has published numerous peer-reviewed articles focusing specifically on abortion safety, chemical abortion, and maternal mortality, and has testified to state and federal legislation. Dr. Skop is also married to a physician and is a proud mother of 2 sons and a doctor. Gavin Oxley, you're going to hear from, is the Med and Law Coordinator at Students for Life of America, and he's the founder and CEO of Future Medical Professionals for Life. He holds a degree in medical anthropology, ethics, and care from the University of Virginia and has been published in medical journals just at the beginning of his medical career. And the media, he was most recently published at Fox News for an opinion piece he wrote on the OBGYN shortage and how it does, or rather does not, relate to pro-life legislation and laws, which we're going to be discussing today. So thank you, Dr. Skop and Gavin, for joining me.
Thank you.
I read your full bios. Normally, I don't read the full bios because this is kind of an informal podcast, but I wanted everyone tuning in to just see just how well credentialed you are, Dr. Skop, specifically, and what a distinguished career you have had, because we hear so much misinformation out there, especially when we're on campuses or when we're having conversations online, that it's really important to get your voice and voices of OBGYNs who've been practicing for decades, talking about what's happening with our abortion laws in America. So thank you for joining me. I really appreciate
Glad
it.
to be here.
So I guess we'll start first with you, Gavin. You had an op-ed that I just loved that was on Fox News this summer. Can you summarize the op-ed for all of the listeners? Like, how bad is this coming OBGYN shortage and why is it happening? I've been seeing articles of I think it was Alabama or Mississippi recently where they're saying it's going to be 70 miles for a pregnant woman to find an OBGYN. Like, what's going on?
Yeah, so I started this article, because I'm in the process of applying to medical schools, and so I've seen sort of like a disparity as I become more acquainted with that process. And Kristan, there was a study done by I believe it was the March of Dimes, where 36% of counties in our country are actually care deserts for people specifically seeking care from an obstetrician gynecologist. And so it isn't a coming shortage, it is a present shortage, Kristan. And so I put this together because, seeing both a side of being active as a student and as a person very acquainted with being acquainted with pro-life bills bills at Students for Life Action, I mean, it's clear that passing pro-life fetal protection laws are not causing a obstetrician gynecologist shortage.
Dr. Skop, you've been in this field for 3 decades, longer than many of the viewers who are watching this podcast have been alive. Have you noticed a rise in this shortage of obstetrician gynecologists, and what do you think it's attributed to?
Well, I think it's important to recognize that these are very complicated issues, but unfortunately, the abortion advocacy industry is jumping on these type of problems in order to promote abortion, which is very dishonest. They're very complicated, and so we really need to get down to what the data really is. I practice in San Antonio, Texas, and we have many rural areas around us. So it is not unusual for rural women to need to travel. I've cared for women who've traveled 2.5 hours one way their entire pregnancy to see me. So this does happen. But the solution, of course, to a shortage of healthcare providers in rural areas is to prioritize recruitment of providers. It is to support these small regional hospitals. Many of them are going out of business, and there's many reasons for that. But let's don't give up on our rural neighbors and tell them that they must either kill their babies or move into the city, that we can't help them. That's very simplistic. It's ridiculous, really. The profession of medicine has changed. I think everyone recognizes that. And one of the things that has changed is that we're no longer thought to be providers who use our own knowledge and experience, our individual interactions with the patient to make the best decision for that patient. We're being asked instead, and this was magnified during the COVID crisis, to follow guidelines. Everyone should march to the same drummer. And that's not the way that medicine should be practiced. I would encourage any students that are watching that do want to go into medicine. There is definitely a role and a place in medicine for students who are Hippocratic practitioners who don't want to kill their patients. So I would encourage that. But I think the shortage of providers is being talked about in the wrong way. And again, it's being leveraged to promote abortion, which is very dishonest and very unnecessary.
Yeah, it seems to me, Gavin, that it's like the whole suffering argument we hear of some children who aren't aborted may end up in foster care or suffer in their life. Therefore, we should just abort them. So it's the same argument here of there's not enough doctors, OBGYNs, to deliver children, that women don't have to drive, an hour, 2 hours to get care. So instead of doing the simple thing, which is alleviate suffering or, recruit and train more OBGYNs, it's kill the babies. Why is it always kill the babies?
Exactly, Kristan. And what's actually happening, I have experienced a ton of students who are actually being discouraged from entering or from even entering medical school, or sometimes even entering the specialty specifically, because a ton of students are told that, if a person's pro-life, that it's not a specialty that they should be in, because pro-life values are not acceptable in practicing care, because ultimately abortion is supposedly a part of essential healthcare, and all of us understand it's not. And so one part I actually talked about is how states who are actually passing pro-life bills should actually be helping to protect pro-life students in order to get all of those students to come and doctors um, uh, um, to actually practice in pro-life states in order to help this crisis. And so, because turning students away isn't solving any problems, because there is a shortage, because there is a shortage of obstetrician gynecologists, and the Department of Health and Human Services actually estimates by 2030 that it'll be a 90% supply. So 10% of people aren't actually going to have access to a obstetrician gynecologist at that point.
It's scary. I mean, it's scary as a woman who's had babies and is open to having more babies, who's moving to a rural area. That's very scary information. But I think you're right, Dr. Skop. You mentioned it earlier, and I'm so glad for what you're doing, Gavin, with future medical students. We've got to be encouraging more young people to go into medicine, particularly pro-lifers and faith believers. And there are, Dr. Skop, you serve on those boards of APOLOG, American Association of Pro-Life OBGYNs. There are associations professional associations that you can join and belong and find mentors to help you through the process of selecting schools, selecting programs to go into, and how to overcome situations that come up. I think it's very sad that we've almost the abortion lobby has, in my view, has created this OBGYN shortage, because for 17 years that we've had Students for Life, not a year goes by where I haven't spoken to multiple students who all said, I wanted to go into OBGYN care and I decided not to because I was afraid I'd be forced to violate my conscience. Which is, I mean, that's what they've done. They've created this shortage. So let's turn to the other side of this. Now, the other argument we're hearing, Dr. Skop, and you've been writing about, is the increasing maternal mortality rate. So this is the same deal. We have higher maternal mortality rates than other countries. Therefore, we need more abortions to prevent women from dying from pregnancy. Does that sound like linear logic to you, or does it sound kind of twisted?
It's very twisted. And it is true that the United States has a horrible maternal mortality rate, but it is a very complex problem. And I would argue that abortion is not the answer. Abortion is part of the cause. We have some of the highest abortion rates in the world, and we spend more per capita on healthcare than any other country. And yet our maternal mortality rates are very bad. But maternal mortality is so complex. I want to back up to the beginning. You mentioned the narrative that our rates have doubled over 20 years. We have known for years that we do not detect as many deaths as we should on death certificates. And so back at 20 years ago, 2003, they added a pregnancy checkbox to death certificates to try to prompt the certifier to document whether a pregnancy had occurred within that past year. Believe it or not, a maternal death is considered to be any death that occurs up to a year after the end of a pregnancy. So a woman has an abortion, commits suicide 6 months later. That should be counted as a maternal death, but the CDC has no desire to know about those deaths. But just to put it all in perspective, while it took the states a long time to put that box on their death certificates, so for almost 15 years, the United States did not report a maternal mortality ratio. And then when they started reporting it again, once everybody got that checkbox on, it looked like we had a dramatic increase, but we were inevitably picking up more. That was the whole point of the checkbox.
Yeah.
But also just regarding maternal mortality, I want to say people assume, and this is a logical assumption, that we're talking about deaths that occur during the act of childbirth. But that's only about a third, or less than a third, about a quarter of the maternal deaths in our country. So about a quarter of them happen sometime during pregnancy, maybe a ruptured ectopic pregnancy, which I think the abortion industry no longer feels like we need to rule that out before we give chemical abortion pills. So we'll be seeing more of those, and those should be blamed on abortion, but unfortunately they won't be. But also, more than half of maternal deaths occur between 1 week and 1 year after the pregnancy ends. And we're realizing more and more that many of those are mental health deaths, deaths of despair. Good quality European studies tell us that abortion increases. A woman who has an abortion has 6 times the likelihood of committing suicide in that year compared to if she'd given her child, if she'd taken that pregnancy to birth. Even other issues, cardiovascular, we're seeing increase. All causes of mortality are increased 2 to 4 times in the year following an abortion. So the abortion industry has done a very good job of intentionally not looking and not finding, and the CDC not finding deaths related to abortion. So then they will dishonestly compare the very few deaths that they know about from abortion, ignoring the mental health issue entirely, comparing that to the ones that they have found related to childbirth, which occurs in a hospital. So those, of course, are going to be much more accurately detected. And then they try to make this comparison and say, well, it looks like, abortion's safer than childbirth. But that's absolutely not the case. When you actually look at all events, you discover that women are much more likely to die in the year following an abortion. And the reason, of course, that we have terrible data here is that abortions are paid for privately. Women don't want to talk about it. So we have almost no way to detect who's had abortions and then link those to subsequent pregnancy events. So I could go on. I've got a 30-page paper on
and
the.
Isn't it true that when? Isn't it true like when you're measuring maternal mortality too? Like if she dies during an abortion, that actually counts towards that number as well.
Right. So the denominators are not the same. They look at abortion deaths compared to the number of abortions. And again, we don't even know the number of abortions. Between the Guttmacher Institute and the CDC, the difference may be as much as 50% different, right? But
wow.
The maternal mortality is based on 100,000 live births. And that's because that's the only number they can calculate with birth certificates. We don't keep a track of any pregnancy outcomes before 20 weeks pregnancy. So we don't know anything about the number of miscarriages, abortions, ectopic pregnancies. And you're right, an abortion death would be counted in both categories, both as a maternal death and as an abortion-related death. So there's so many data problems. They're not comparing apples to apples. It's clearly apples to oranges. And we've got both numerators and one denominator that we have no idea. We cannot accurately calculate. So it's, you can't make the comparison, and to try to make the comparison is dishonest. And yet we see the abortion industry is trying to make this comparison. I would say one other thing about later abortions. One thing that we do know, if any of your audience knows about D&E dismemberment abortions, these are very complicated. They're very brutal. They're very violent. They're probably 10% of the abortions in this country. And the CDC has documented that for each additional week of pregnancy that an abortion is performed, mortality goes up by 38%. If an abortion is done after viability, which is at 22 weeks, and we are one of only 7 countries in the world that will allow a baby that can survive separated from his mother be electively killed. But if an abortion is performed at that point, it is 76 times more likely to kill a woman. So abortion restrictions are going to protect women by letting them not be forced. And many of these women are coerced into these late abortions. That just won't be an option for them. So that will protect them.
That's unbelievable, because you often hear, and Gavin, I'm sure you heard this when you served as a regional coordinator at Students for Life, that we need these late-term abortions. One, everyone says they don't happen, and then they'll say, well, we need them because these women who are having late-term abortion, these mothers for having late term abortions or having them because they have these high risk pregnancy situations. But then you're saying, Dr. Skop, that it has a 76% increased chance it's going to kill you.
Right.
So how does that make sense? I mean, Dustin, how does that make sense? I mean, sorry, Gavin, how does that make sense? We only have a few men on the Students for Life team. Let me back it up here. So I get them all confused. We're not sexist or anything, but somehow men just don't want to work for us. No. But Gavin, how do you make that make sense when having a conversation with a student?
I've had a lot of conversations with a wide variety of students, and really it doesn't always make sense to them, Kristan, because they're not very data driven, and so what I would say a lot of times is that what I have to do is step back and have them think about it from like a perspective of what's most compassionate to do a lot of times, because a ton of pro-choice students or pro-abortion students are fueled by false compassion a lot of times. And so right. I have to step back and say, okay, what is compassionate to preborn children and also mothers in high-risk pregnancies? It's not the abortion. Abortions are dangerous. Abortions are violent. But what's compassionate is to treat them with high-quality care and care that supports both mother and child. And there are a lot of doctors trained in high-risk obstetrics who are capable of treating patients compassionately without killing a preborn child that is normally perfectly healthy. Going back to what Dr. Skop said about mental health issues on the campus, a ton of times I'm told that that outcomes from suicide or anxiety and depression should not be counted in the impact abortion has, because it's not directly correlated to a procedure, and it's her own responsibility to get care on her own afterwards. It's an abortion, and it's an abortion, and then a woman's on her own, and that's just not compassionate. And it's important to keep in mind that every procedure a doctor does has outcomes that are not directly tied to performing a procedure itself, whether it's anxiety or depression or suicidal ideation or behavior. All of those are still tied and have to be taken into consideration of what true compassionate care is. And I don't think students understand that.
That's absolutely true. It is. It's just like this false sense of compassion, and I don't think anyone has these conversations. They're certainly not getting this information from the abortion lobby. Dr. Skop, you're taking care of women in rural areas, in Texas. Oh my gosh, you're in Texas. Women are dying left and right in back alleys from not being able to have abortions. If you leave it up to the mainstream media to narrate this. But you mentioned this terrible maternal mortality rate that, we've seen in other countries like Chile, Malta, other countries over the years. Ireland for a long time was abortion-free, that, they were abortion-free and had the lowest maternal mortality rates in the world. What do you think we can do as pro-lifers, or just generally as human beings who care? How can we lower the maternal mortality rates in our country? Is it having those real conversations about mental health and postpartum depression, since so many are happening after birth?
Yeah, I think that obviously the mental health component is huge, and recognizing the ways in which readily accessible abortion and the narrative that either having an abortion or carrying a child to term is a woman's choice only. I think we all recognize what that has led to is men to be disenfranchised, to say, it's not my choice either way. And we've seen that has led to a skyrocketing of single mothers. 11% prior to Roe, it's now 40% across the board. In the Black population, unfortunately, it's 67%. 2/3 of these women do not have a man supporting them in marriage at the time that they have a child. Well, we know the ramifications of that. Those women are more likely to live in poverty. And poverty is associated with many risk factors for maternal mortality, not having access to good health care, having other comorbidities, hypertension, diabetes, obesity. Those things do predispose women to more difficult pregnancies and deliveries. So just recognizing that abortion has led to that, and that is causing our maternal mortality rates to be higher. Go into the Black population. It's so sad and so dishonest what happens. So they have 3 times the maternal mortality rate. They are disproportionately affected by this horrible problem. They also have 3 to 4 times the abortion rate. If abortion were protective, we would not be seeing both of those things being true at the same time. And yet, this narrative is being used to frighten women into ending their children's lives because they're under the impression that they are so much at risk. One death is too many related to childbirth and pregnancy. But when you look at the numbers, we're talking about 700, maybe 800 deaths a year. When you compare that to your likelihood of dying in a car accident in a given year, your likelihood of dying in the car accident is higher. And yet we have but the narrative about this maternal mortality crisis has frightened a generation of young women into not wanting to have children because they're convinced they're going to die. And it has fueled the abortion industry's promotion of this procedure that kills one human being and harms another in almost every case. And by the way, our total fertility rate is below replacement. We need babies. And in the 30 years that I've been practicing, of course, half of pregnancies in our country are unintended. They happen, maybe they're welcomed, but they weren't necessarily trying. But the women who carry these babies to term all love their babies when they get there. So even if a pregnancy is initially unwanted, unintended, these women do want their babies if they're not frightened out of it. And also if they're not diverted so that they don't know the resources that are available. 2,700 crisis pregnancy centers in our country. Every state of the union, every big city has them. Resources, emotional support, financial support, material support. Virtually every state that has passed abortion restrictions has also passed extensive social support and alternatives to abortion funding and all of this. And so I am optimistic. I think the states that are protecting unborn life in a few years, when we get the full data, we're going to see their maternal mortality rates improve because they're caring for women the way we should be caring for women. By the way, also, a lot of these states, because they're usually conservative southern states, they have higher incidence of poverty. They have higher incidence of rural women living in rural locations. And so all of those things are occurring. It's not an apples to apples comparison there either when you're looking at abortion restrictions. But again, the pro-abortion medical organizations, the AMA, ACOG, they know better. They know that these are complex issues, and yet they're leveraging them primarily to scare the American people into not supporting their laws, to scare women into aborting their children. And it's unconscionable what's happening.
Have you ever, I want to back up something you said, half of all pregnancies are unattended. Those are all 4 of mine. But have you ever met a woman who became pregnant, delivered her child, and then regretted having her baby?
No, I never have.
I ask that question all the time when I speak with physicians, OBGYNs, and it's I think it's something that we hear all the time on campuses, Gavin, that these women are going to regret having their baby. And I'm like, can you name one person that tells you that? Because there was a Washington Post piece a couple of months ago, and it was about these high school dropout children who got pregnant with twins right before the Texas heartbeat law went into effect. They couldn't have the abortion in Corpus Christi. And this whole piece, and like the headline was very pro-abortion, but the end of the piece, it was the woman saying, I can't imagine my life without my children. And she's in school to be a realtor. He stopped his dreams of being a professional skateboarder and hanging out in the city park and is now in the Army. Like, their whole life is better because they had these children, which forced them to grow up. And yeah, it was just interesting because it was like this pro-abortion narrative and headline, but it, like, if you read the whole article, it seemed very pro-life because they wanted to have an abortion, and then they realized I can't imagine my life without my children anymore. So I wanted to ask you that. Also, how is it in Texas? Are there women dying in back alleys in Texas?
I'm so glad you asked, because I do want to talk about this whole narrative that says that doctors can't do their jobs. 25 states have passed legislation restricting abortion in some way. Every single state allows an exception if an abortion is needed to protect a woman's life or to prevent substantial impairment to an organ system like her kidneys or her heart or something like that. Every single one has an exception. What has happened, and this is the worst thing that I've seen the medical organizations do, is that normally when there's new legislation, doctors aren't attorneys. We need somebody to give us like guidance. Like, what does this new legislation mean? They have been absolutely silent. They have not given doctors any sort of guidance. In the meantime, the mainstream media has gone overdrive to say doctors don't know if they can treat ectopic pregnancies or miscarriages or this or that. And the doctors are not reading the law, because the law specifically says exception, ectopic pregnancy, exception, miscarriage, right? But they're reading the newspaper, they're talking amongst themselves, and they have convinced themselves that sometimes they can't intervene. But let me tell you what it looks like, these life-threatening conditions. Most of the time they happen after the baby can survive, separated from his mother. So my job as an obstetrician, and by the way, 90% of obstetricians do not do elective abortions. So even though it's mentioned as necessary medical care, if it was necessary, we'd be doing them, but we don't. We know it's not necessary, but we will intervene. Usually we can induce labor, or if appropriate, do a C-section. And after about 22 weeks, the NICU team can swoop in, they can care for that baby, and he can usually survive. Even in the situation, perhaps 18-week previral rupture membranes with infection or something like that. What I do is I deliver the baby, again, by induction. I know he's not going to survive, but I know his mother needs that action. She can hold him. She can grieve him. It's so much healthier. I've never had a patient say, no, can you please just dismember him instead? Of course not. So even if we know he's not going to die or he's not going to live, there are so many more humane ways we can care for this woman than to do an abortion on her.
That's right. That's absolutely right. Well, I mean, I want to thank you, Dr. Skop and Gavin, for coming on and giving this, I think, some good facts, like just facts to add to this conversation that you're hearing online, that you're having on campuses, that you might be having with coworkers. Gavin, where do folks, and especially, med students or future med students, how do they get plugged into what you're doing at Future Medical Professionals for Life?
So they can find us online at futuremedpros.org, or they can find us online at Medical Students for Life. And also, I encourage people to sign up for our speaking tour this year and bring Hippocratic doctors on to campuses to speak truth into these hostile environments.
That's awesome. I can't wait to see the conversations that you have on med school campuses. Dr. Skop, how do folks follow you? And I mean, I try to follow anytime I see that you've written something publicly. Like, do we follow the Charlotte Lozier Institute? Where can we go and like get these materials that we need to have in these conversations?
Yeah, absolutely. I think education is key. Nobody knows enough about because they're very complicated. On our website, losierInstitute.org, I have several very, very in-depth papers about maternal mortality in our On Women's Health series, also about the life of the mother, all of these things that we've discussed today. We have a tremendous amount of information on chemical abortion, which everybody should understand what's going on there. And also for students, again, I just would encourage pro-life students to enter medicine. We need it. The profession is desperate for doctors who have a conscience. And by the way, there is a federal law that prohibits your program from forcing you to do an abortion. So nobody can make you do an abortion, although there are some programs that are friendlier to that than others. So it is useful to talk to other people applying for programs to find out where the better programs are. But again, 25 states are protecting life. That's a great place to do a residency. And to prove the pro-abortion doctors wrong who are worried that doctors won't go to those states, doctors who want to deliver babies, which is what obstetricians do, are going to go to those states. Texas has had 1,000 more babies born every month since the Dobbs decision. So that's not a bad thing.
I know. We were blamed for a diaper shortage, I think. There was a Newsweek op-ed blaming pro-lifers for a diaper shortage after the Texas heartbeat law went into effect. I was like, once again, the solution isn't make more damn diapers. It's kill babies. By the way, you should get your diapers at everylife.com because that is the only pro-life diaper company. And they make wipes too. But it's unbelievable. Like, we're getting blamed for a diaper shortage because there's so many babies being born when we're still in this, population decline. Everyone should be thanking pro-lifers, but we'll wait for that. There'll be plenty of time for that one day. But thank you, Gavin. Thank you, Dr. Skop, for joining us. This was a great conversation. I learned a lot. I was taking some notes. I hope you were taking some notes. I think I'm going to have to go back and re-listen to this call and take some more notes. So you'll see me repeating Dr. Skop and Gavin's words on campuses in a video coming soon. But this is so important for us to have important conversations and fact-filled conversations, not these fear-mongering conversations that the left is and the abortion lobby is pushing. Thank you so much for tuning in this episode of Explicitly Pro-Life. Make sure you share this episode. Bye, everyone. What if I told you that the parent company of every major brand of diapers was paying the travel costs of their employees to have abortions? It's one thing to reject your customers. It's another thing entirely to support killing them, just outright killing them. If you're disturbed by this, supporting diaper companies that support destroying babies, then meet EveryLife, America's pro-life diaper company. EveryLife makes premium diapers and wipes, and they believe every baby is a miracle from God who deserves to be born, to be loved, and protected. Go to everylife.com for diapers and wipe bundles that can be delivered to your door. There's even an automatic monthly subscription. And know that your purchase is not only going to swaddle your baby's butt in the best diapers they can get, but also change lives by supporting pro-life organizations like Students for Life of America. That's everylife.com. And if you can spell my name right, use promo code Kristan10 and get 10% off your first order.